How do you make the right choice when it comes to Medicare and Medicare insurance? Welcome to Retirement Revealed. I'm your host, Jeremy Keil, and we're here to turn your retirement savings into retirement income. Today, we're talking about the 6 steps you need to take to master Medicare. And I got these 6 steps from Melinda Coghill. She was on our podcast last week, talking about the ultimate Medicare guide, giving us some smart strategies. Also got a lot of the ideas I'm sharing with you from Medicare for You, which is a great book written by her mom, Diane Omdahl. And of course, I like to give away books like education. So the first 3 people that email me, podcast@keilfp.com, podcast@keilfp.com, I'll send you out a copy of that Medicare for You book. Well, the 6 steps for Medicare, actually, before I tell you the 6 steps, I want to share with you the 3 steps that most people feel are how you sign up for Medicare, how you get Medicare right. Melinda shared this with me, and I agree. Most people think you first choose the plan that you're going to buy for your Medicare insurance, then you enroll in Medicare, and then you just buy that plan, right? You choose the plan, enroll in Medicare, buy the plan, you're done. And she believes that there are 6 total steps. There's 3 parts to this that are missing. Probably the 3 most important parts are missing. So she breaks it down into 6 different steps and going into the right order. And so here I'm sharing them with you. The first step is signing up for Medicare at the right time. And you might say, oh, it's easy. It's 65. Everyone has to sign up for Medicare at 65. I hear that quite often. You have to sign up for Medicare at 65. That's not the case. You don't have to sign up for Medicare at 65, but you probably will, right? Here's a few things to keep in mind. If you're already on Social Security, you don't even have to sign up for Medicare. It's going to happen. You're going to get your Medicare A, Medicare Part B automatically. They will send you out that Medicare card. Although just because it automatically happened doesn't mean you have to accept the Part B part of it. You could suspend Part B, the doctor part of Medicare, if you want to, if you need to. We'll talk about that. I've had that happen a few times on purpose because they went through and said, here's the different things that are going on. So your Social Security benefit status, if you are already on Social Security, you're going to get signed up for Medicare, which also means too, if you're not on Social Security, a lot of people think, well, it just happens automatically, right? If you have to sign up for Medicare at 65, it's just going to happen. I'll just get my Medicare card sent to me. My friend had their Medicare card sent to you. Well, your friend was on Social Security and you weren't. Right? So if you're not on Social Security and you want to sign up for Medicare, you need to actually proactively go sign up for Medicare. But don't just automatically do this. Let's think this through. Here's a lot of different things. I've seen both sides of it for everybody. Melinda shared with me the only thing true about Medicare for everyone is that nothing is true about Medicare for everyone. It doesn't, nothing is absolutely 100% everyone has to do this with Medicare. So here's some common things where people are thinking, do I have to sign up for Medicare or not? A common one is, I'm on COBRA. I don't need Medicare Part B, right? I don't need Medicare. I'm covered by COBRA. Or I've got my retiree insurance. I'm covered by that, so I don't need the Medicare. And the whole point of Medicare, you actually can wait past 65 if you meet a few rules. And the rules are, they call it a group health plan. Are you covered by a group health plan? Well, COBRA is like a group health plan. Retirees health insurance is like a group health plan. No, it's not. In the world of group health plan, it means group health insurance based on current employment. So if you're working today and getting health insurance today from the place you're working, that's a group health plan. Or maybe it's your spouse that's working today and getting health insurance today. That's a group health plan where you can delay your Social Security. Here I am. I'm doing the same thing that everyone does where you think Social Security and Medicare are so linked. I'm going to try not to do that. Again, good point here. Social Security and Medicare are somewhat linked, but they're not exactly the same thing on there. So you can delay and not sign up for Medicare if you are on this group health plan and your employer size is above 20 people. That's a rule there. So if you are below 20 people, you go into work and there's less than 20 people working there, 65, you need to sign up for A and B. Otherwise, you might be late. And the reason reason for that is when you have a group health insurance coverage, there's less than 20 people, that business and the health insurance plan can say, we're going to exclude anyone at 65 plus and say, we're not going to cover them. We won't be the primary payer, which makes sense for them, right? They're going to pay less for someone at 65 plus. But if there's more than 20 people in that group health plan, they can't exclude you. They can't say, oh, you're 65. We don't want to pay the cost of it. And so there's if you've got more than 20 people in your group health plan, you could say, I'm sticking to group health plan from my current employment or a spouse's current employment. I don't have to sign up for the A and B part of Medicare. Although you're likely to sign up for Part A. Part A is free. It's in case you go to a hospital, but you're not required to sign up. And a lot of times, if you are over 65 and you've got your health insurance through your employer, it's kind of like, why would you sign up for B, right? B, Medicare insurance for going to the doctor costs about $175 a month. And you've got that insurance is the primary provider, right? They're sending the bills to your company group health insurance to pay for it. So why would you pay that extra $175? So you probably would not sign up for B. You probably would sign up for A because, hey, why not? It's free, right? But it's not required. You don't have to sign up for A. You don't have to sign up for B. You probably won't sign up for B, but you just might sign up for A if you've got more than 20 people in that group health plan. And I've seen people do that, right? I've got clients that I've counseled them, said, well, based on, okay, you're turning 65, you don't have Social Security, and you've got more than 20 people in your group health plan, and you actually like your coverage, the cost is fairly low. Why don't you just keep the coverage, and you don't have to sign up for B, but you might as well sign up for A, unless this next reason. And that next reason is your HSA status. When you turn on Medicare, right, when you're signed up for Medicare, you can no longer contribute to an HSA. A lot of people like the HSAs, right? They're putting in $5,000, $6,000, $7,000, $8,000 a year into the HSA, and they love the tax deferral and the tax-free withdrawals for health costs on the HSA. And so they hate turning 65 because you hit up Medicare. Once you're on Medicare, you cannot contribute to that HSA. So maybe you are one of these folks that has a group health plan, access to it, and you have the choice of whether you want to go on Medicare or not. Think about, do I want to have access to the HSA, right? And a lot of people, they tell me, well, I can't sign up for Medicare because I have the HSA. Well, I go look at their tax return and they're putting in like $500 to the HSA every year. I mean, that's not really too big of a tax benefit. So truly, are you actually making the best use of the HSA status? And if you are, maybe that's a reason to avoid Medicare if you can. And of course, you can avoid Medicare if you're on that group health plan with more than 20 people in that group health plan. And you've got those options, right? How much does it cost you to have your employer pay for the health insurance? Maybe it's really cheap, $50 a month. Maybe it's more expensive, $1,000 a month, $500 a month, right? What's the coverage between the two, right? You got an option there when you have access to that group health plan, or you could go on Medicare. So you've got those different comparisons. You got those different options that are on there. So then you've got to sign up for Medicare. You've determined, okay, I need to sign up for Medicare at this right time. If you are signing up for Medicare because you're turning 65, you've got that initial enrollment period, which is the month you turn 65, and it's the 3 months before, the 3 months after. So there's a 7-month window. And a lot of times people say to me, well, I got to sign up for Medicare by my birthday on February 20th. Well, it's not the 20th. It's not the day of the month that you turn 65. It's the first of the month. It's the month you turn 65. Although just to be difficult, the government says it's actually the day before your birthday is when you attain your age. Seems interesting to me, and doesn't matter much for too many people other than if you're born on the first of the month. If you're born on the first of the month, that means the month you're eligible for Medicare is the month earlier. So keep that in mind if you're on the first of the month. So chances are a lot of people, this is why people say you have to sign up for 65. Not true, but most people do. You sign up for 65, you get the month of, 3 months after, 3 months before. I would very much encourage you to sign up beforehand for Medicare, because it's effective then right away on the first of the month when you turn 65. If you actually sign up for Medicare in that month, it's not effective until the following month on the 1st. And so a lot of people think, well, I just got to do this by my birthday. The birthday's the 20th. They sign up on the 10th. They think, well, I'll be good. I'm at 10 more days. And no, it's not until the following month that you actually are good for Medicare then. And that might have a gap in coverage for you. So plan this all out ahead of time. Something that could happen if you're one of those folks that says, I'm waiting till after 65. Well, then you've got now the special enrollment period, which is after you stop working or after your coverage stops. And a lot of times those are kind of linked, but I've had folks where they say, well, I'm retiring on January 1. I'm just going through the my open enrollment at work, and I'm just going to not get health insurance coverage because what's the point? And turns out health insurance coverage doesn't start January 1st, starts December 1st. So wait a second, you're working through January 1, but it's December 1 when your health insurance stops. Well, it's 8 months in after the health insurance stops, or it's 8 months after you lose employment, whichever is the first one of those two. And those, the day you lose employment and the day you lose health insurance coverage are usually not the same. So you want to figure out which one happens first at 8 months, but why would you go that long without coverage? Well, maybe you're on COBRA, right? And you're just kind of riding COBRA out and you realize you've got 8 months to sign up for Medicare, so you can go ahead and do that. So most people get to 65. You might have worked past 65. You were covering that group health insurance coverage, and you just sign up in that special enrollment period afterwards. But what if you missed all that? If you missed all that, you've got the general enrollment period. So January 1 through March 31, you can start your coverage in Medicare. The coverage begins the next month on the first of the month, but then there's a 10% penalty for every year that you've missed in the past. So the hope is not to ever get to the general enrollment period, but thank goodness they have it just in case you need that. So that's a bit of when you, I don't know if have to, I don't want to say that. I don't want to say when do you have to sign up for Medicare. It's when you maybe should sign up for Medicare based on the timing of it. That timing is the most important part of it. That's where Linda Coghill and her group, when they're counseling people with Medicare issues, that's one of the biggest problems they have. Followed by the second biggest problem they have, which is select a path. That's the second step, is to select a path that you want to take with Medicare. And that's a choice between, do you take the traditional government Medicare or do you take the newer corporate insurance advantage path? Now, on the Medicare path, there's the parts you may be used to because that's what your parents went through, because this advantage path is more newer, where it's the Part A. That doesn't cost you anything as long as you qualify. Most people do. That's if you go to the hospital, government's helping you pay through that, through Medicare. Part B is the doctor visits. That's kind of your normal health insurance, right? You go to the doctor, checkups, sick visits, things like that. That's Part B. So you're signing up for that. And you're signing up for Part B even if you take the Advantage plan. A lot of people don't realize if you're taking the Advantage path, you're still signing up for Part B. You're still paying the cost for that Part B Medicare insurance. And then there's also Part D. This is the part you miss a lot of times, I feel, when you go with a traditional government plan, is that you've got to then buy a Part D. I guess you don't have to, but wise to buy a Part D to cover those prescription drug costs. And a lot of people, here's a mistake a lot of times happens, I think, is you get 65 and your prescription drugs are either cheap or you don't have any at all. And you say, well, I don't need the drug coverage. Well, Part D is just like Part B, where every year you waited, there's a 10% extra cost penalty. So perhaps just take the cheapest Part D plan you can find, even if you don't truly need the coverage. You want to be prepared and perhaps avoid that penalty down the road for signing up for drug costs later on, drug coverage later on. With that Medicare path, there's really no out-of-pocket limit, which means if there's a huge cost, you could be paying the huge bill. Medicare generally pays 80% of the cost, but that means you're on the hook for the 20%, unless you buy a Medigap insurance. And everyone asks me, what is Medigap insurance? Who should I go with? What does it cover? Here's the simple answer. Medigap insurance pays for what Medicare covers, but what Medicare doesn't pay, right? If Medicare covers it, Medigap covers it. If Medicare covers or pays 80% of it, then the Medigap pays that 20% difference. And a lot of times when you're choosing this path, if I want the traditional government Medicare, you've got 6 months after enrolling in Medicare where you can call any Medicare insurance company, the Medigap insurance company, and say, I want to be part of your plan. They've got to give that to you. It's called a guaranteed issue right. If you start out with Medicare Advantage, you have the same thing too most of the time, as long as you do that switch within 12 months. So you could switch from Medicare Advantage to supplement in the first 12 months. But after that time frame, right, after you've just signed up for Medicare overall, or you start with Medicare Advantage and you have gone that 12 months, you might not be able to switch. The government says the insurance company doesn't have to take you on. They can do underwriting, just like your life insurance might have an underwriting, say, do we want you or not? And who do insurance companies want to have? The healthy people, right? So it's good if you are going into the traditional government path and you want that Medigap insurance. And because there's no out-of-pocket limit, I think it's advisable, it's wise to consider that Medigap so that you're not on the hook for that 20%. Let the insurance company be on the hook for the 20%. Roughly speaking, that Medicare path, that traditional government path, might be about $400 a month. But afterwards, it's basically no out-of-pockets for the health cost. That's at this point maybe $175 or so for the Medicare Part B, about $185 for the Medigap insurance. There's a $250 per year deductible in the Part B world, so that's like $20 a month. Maybe it's roughly $30 a month for Part D, the drug coverage. So that's where you get about the $400 a month per person. $400 a month per person, which, especially if there's two of you, now we're talking $800 a month. That sounds like a lot of money, and certainly it is a big cost, but that's a bigger ongoing premium cost that eliminates most, if not all, of the out-of-pocket expenses that you'd have in the world of Medicare and health insurance, health costs. But because it's a $400 a month, a lot of times that Advantage path looks to be something that is enticing, where the cost is the $175 a month still, right? You're paying $175 a month for the Medicare Part B, but oftentimes the cost of an Advantage plan might be $0 or maybe less than $100, you know, $0, $30, $50, $80 I've seen on there. So the ongoing monthly cost is certainly us, which is very attractive. That's why about half the people that sign up for Medicare now or part of Medicare are in the Advantage world. But there's some differences. It's not the Medicare being in charge and all the doctors that accept Medicare available to you. It's the insurance company in charge, which means there's three parts of it you've got to keep in mind. There's networks you got to deal with. There's prior authorizations if you want to go to specialist. And unlike Medicare, traditional Medicare, there's the deductibles, copays, out-of-pocket costs, where yes, it's a lower monthly premium, but the total cost is unknown. And so you've got to just weigh those two. Do I need and want that lower monthly cost with the unknowns, or do I want the higher monthly costs with less unknowns on there? Another thing to keep in mind is, like I said, it's easier to go from supplement to Advantage. You can always go from supplement to Advantage. It's not always the case that you can go from Advantage to supplement. So keep that thought in mind. It's not just what decision do I want to make right now, but what decision might I want to make down the road when I'm not 65, but 75, 85, 95. Consider the entire lifetime of your retirement and then choose the Medicare path. If it's the traditional government path or the more newer corporate insurance path. Now, once you've done that, you've done two of the biggest things. Probably 90% of it is good to go. You've found the right time for you to file for Medicare. You're choosing the right path that makes the most sense for you. Well, now you got to choose a plan. And quite often when you choose a plan, you're either going to just go through the entire 2-foot stack of brochures that are sent out to you, or you're going to go with the insurance agent. And if you're choosing an insurance agent, which I personally think is the preferred method, they probably know about the Advantage and Medigap insurance landscape more than you on there, and hopefully they're reputable. But it's tough. How do you decide which insurance agent to go with? I would encourage you to find some independent, a brokerage insurance agent, someone has access to a lot more different plans. I saw in Wisconsin that there's 4 different Medigap companies, 8 different Advantage plans that you can choose. So when you're meeting a financial advisor or really an insurance salesperson, a Medicare insurance salesperson, it's a lot of times they focus specifically on that. And with 12 different companies to choose from between Medigap and Advantage, probably worthwhile to work with someone that does focus exactly on the Medicare insurance market. But there's some differences between Advantage and Medigap. Honestly, if you're an insurance salesperson, you get paid a higher commission to sell the Advantage plan than the Medigap. So there's a bit of an interesting built-in bias there. So if you're trying to find an independent insurance agent to help you find the best Medigap or Medicare insurance, Medicare Advantage, ask them, do you sell everything, right? Do you sell the Medigap and the Part D, or do you only sell one, like Advantage, right? How much Advantage do you sell? What's the overall percentage? If they tell you 99%, and yet 50% of people nationwide are buying Advantage, well, it seems as if they're maybe biased towards one way. I don't know what the true best percentage might be, but something more balanced is probably showing you that they've got a more balanced approach towards providing you advice. And of course, how many companies are you allowed to sell? They might only be appointed with 2 companies, and if there's 12 out there, how do you know that you have access to all the best ones that are out there? So choose that plan. Part of choosing that plan is finding that best insurance advisor. One way to look at the different plans out there is with the Medicare.gov plan finder. I like going there just to get that answer of how many different Medigap and Advantage plans are there. And there's so many of them, right? I saw in Wisconsin 42 different Medicare Advantage plans from the 8 different insurance companies. I wouldn't necessarily use it to find and become an expert at all 42 plans, but now I know there's 8 different companies. I can call an insurance agent and say, hey, how many companies do you represent? That's a good question. They say, well, 2. All right, well, there's 8 different companies out there. Maybe I'll go call the next person to see if they've got a broader array out there. And so now you've figured out, when do I file? Which path am I going on? I've got the plan I want to go with. Well, now you go enroll in Medicare. And when you enroll in Medicare, quite easy. It's ssa.gov. Should take you 5 or 10 minutes to do that. Just don't do that in your birthday month. Usually that's not the case. And maybe there's a reason to do that, but most of the time it's, my birthday's on the 20th, and I'm just going to sign up before then. I'll be covered on the 20th for my birthday. No. It's good to be signed up ahead of time. So ssa.gov to enroll in Medicare. And you want to enroll in Medicare first, because when you enroll in the plan, that's going to be something you ask. What's your Medicare enrollment number? Well, you got to get your card and get enrolled in Medicare to find out what's that Medicare enrollment number. And I like this path that Melinda laid out, because this is a long-term solution, and you want to take this a bit slow. And usually what I find you're doing is you are just looking at the first couple brochures and trying to learn every single thing you can about each individual company and each individual plan. And then you get overwhelmed, and then you kind of give up, and somebody gives you a card and says, oh, call my insurance agent. They'll help you out. And you talk to them, and they just sell you the plan on there. I think the research you ought to be doing, because it really affects you yourself, is when do I sign up? Which path do I want to go on? Who's the independent brokerage insurance agent that I want to go with? And then let them say, here's the plan that works out best for you. And that's best for you is based on here are the doctors I want covered. Here's the prescription drugs that I'm taking. It seems like you're trying to do this backwards. And I hate to tell anyone they're doing things wrong, but I find most people are doing things wrong when it comes to signing up for Medicare, where they're trying to just learn all there is to know about every single thing with insurance companies and plans. If you've taken the time to figure out when to sign up and how to get the best path and how to find the best insurance agent for you, trust them that you've given them the information about the doctors and the drug coverage and the path of Medicare you want to take. They ought to know a lot more about these companies and the plans that the companies are selling, and trust them if you found the right one to go with that plan. You don't have to know every single thing about your plan. It's the other things that matter more. But then once a year, the plans change. If you're on an Advantage plan, the network might change, the drug coverage, the pharmacies might change. If you're on a Part D, if you're on traditional Medicare, the drug formulary is a term that might change all the time too. And one way to do this is you can go to the Medicare.gov plan finder, and you can put in and save your prescriptions on there and let the Medicare.gov say, okay, based on this, here's actually the plan that works out best for you on it. Or actually, Melinda's got a new service. It's heymo.com, hey, HEYMOE.com. And you could have her take a look and say, here's all the best drug coverages. I found the Medicare.gov plan finder is good. I've heard from a few Medicare insurance agents that it's not the best. They feel that there's some other sources out there. And Melinda and her company has the sources where don't just assume that whatever worked last year is going to work this year, because the insurance company can change it every single year. So even if you're on the traditional Medicare plan where you've chosen this traditional Medicare path for life, your Part D prescription drug coverage, that could change every single year. And you could change prescription drug coverage every single year if it makes sense for you, which is why it's worthwhile. Again, it's the backwards way to do it. I think a lot of people say, what's the plan? Let me look at what it covers. I think the better way to do it is say, what do I need? And let me find the plan that covers that. So you've got here the 6 steps to sign up for Medicare, make your choices on Medicare, so you're making the right choices. And remember, it's an ongoing situation. Step 6 is review it every single year. I've got a link in the show notes to where we have all these lists down, the 6 steps. I'll put also the podcast. If you haven't listened to that with Melinda, she'll break down, here's the ultimate Medicare guide and her strategies to help you make better Medicare choices. And of course, that the heymo.com looks interesting. The HEYMOE.com looks interesting to say, hey, let's just automate that, put in my prescription drugs that I take and the pharmacies that I go with, let them give you an alert to, oh my goodness, your plan is changing. Here's one that could save you some money. Thank you for listening to the Retirement Revealed podcast. We believe if you know more about your money, you will feel better about your money and you will make better money decisions. Hi, I'm Jeremy Keil, owner of Keil Financial Partners. And if you're interested in seeing how we help our clients get more income, pay less in taxes, and avoid big retirement mistakes, make sure to go to KeilFP.com. That's KeilFP.com.